integration, what I in therapy see, what is really important to integrate the perspective of the patients, because what I learn and what we try, there are guidelines and there are things that have to be done, but we have to take the patient's perspective, because if we just do something that is not the best option for the patient, this is creating more stress. And there was also another study where I was really surprised about it, because they had two groups. One was the braced group and the other one was the observation group. And normally we think that bracing is creating a lot of stress. And they realized that the patient who couldn't participate in their treatment decision, that they had lower quality of life. So I think this really shows that we have to help the patient to find their best treatment option, more than to tell them what is the best treatment option. And also to recognize the stress, sorry, because we know if we recognize it early in adolescence, we can offer them options to bring the stress down and to find their resources instead of creating more stress. But this is something that I, as a therapist, also had to learn, because when you're motivated, you want to do the best for the patient, but sometimes not to do everything is sometimes not the best. It has to be adapted to what the patients really need. And what I try is always to integrate fun into the treatment, because this is reducing stress, because the teenager have to wear the brace, they have to do the exercise, and I don't want that they lose the fun of movement, because sometimes if the rules are too strict of the correction and there's too much tension, they can start to lose of having fun with the movement. And this is for me something really important. And there is for me, there are like two parts, like the integration of the scoliosis and the correction. And for me, it is really important to integrate the scoliosis into the whole body, that it is like Elisa said before, that they don't fight against the scoliosis, that they integrate it, because what I see in therapy, if they do too much correction, they do a lot of muscle strength, and if there is too much fighting against it and too much muscle power, it can produce tension, and it can produce stiffness, and it can also produce pain. And for every patient, this best position is different, because there is also, I think, as a therapist, we should not put the best posture to the patient, because they need to feel it. If we sometimes from the outside, we see, oh, this is a great correction, but the patient cannot feel it in their own body, or they cannot feel it as a good posture, also if it's looking really nice, then they don't take it home. They will use it during their daily life. And for me, there was a learning that I do sometimes less, but I try to do only as far as the patient, as it feels good for the patient, because then they can really use it. And then it's not like they have to do it, but they feel fine in the position. And finding to try the resources and to start in really small steps. What I often do with patients when they are doing sports, they can also bring movements to therapy, where they realize that they are a little bit stiff, or that they think that don't go well. And then we start to work with these movements, and then they realize really fast that they are getting better and they start to get motivated. And this is different for every patient. This is always a little bit trying.
Okay, so now the part of the acceptance and integration from the psychotherapist view. This is Dick Schwartz. He creates this system, internal family systems theory. And he says that people normally want to change and come to the to see a therapist because they want to change. But this is the first obstacle to change, the lack of acceptance of the situation. And I think that we can use this model. It's very complicated and I have not the ambition to explain in this few time. But if we enter in the idea that we have to help our patient to accept scoliosis and all the emotions, that the feelings that are related to scoliosis, this will be the first steps. And how we can do this? Don't correct, but try to notice what is happening and to help them to accept. So, for example, if I have some examples there later, I will explain. His theory, the theory of Schwartz, is that everyone contains a society of people in our mind. We are populated by subpersonalities, he calls. So there are different parts that are present in ourselves. For example, the shame. Shame is a very common emotion when the person has to wear the brace. So in this theory, shame is the part. There are other parts, and this part collaborate because this therapist was a family therapist, and he is using a familiar model. So the shame can be an obstacle to the part of the patient that want to do the treatment, or there is another part of the patient that want to be compliant, that want to be pleasant, want to be pleasant to the parents, to the physicians, no? So our shame and the other parts are related. Maybe sometimes they are allied, sometimes they are in opposition. So he says that we have to express, to help the patient to express, not to suppress. If a person is ashamed for the brace, try to speak with him or with her about his shame, not to suppress it. Come on, yes, you can. You are brave. You can show your brave to your friends. So why? Because shame is a part that is trying to avoid painful or threatening situations. So it is a protecting part. So shame has a function. If we keep away shame and we don't understand the function of shame, the work, it is very hard and it is very difficult to have a real connection of the person, a real motivation to the treatment. So the goal is not to eliminate the parts, the emotions, but try to relax these parts. And this is the way it does, to connect the person to the self. That is, in the neuroscience, we have talked about the parasympathetic nervous system and sympathetic nervous system. When Catherine is making fun with the patients, is trying to help them to enjoy with the movement, she is connecting the patient with the parasympathetic. And Schwartz, this therapist, will talk about self. Self is the state of awareness. When the person is in connection with his self, he is in connection with these 8 C's, that are compassion, curiosity, creativity. So the person can be in this state of courage, clarity, etc. And we have to try to help them, the person, to shift from the parts to the self, and to connect them to a state of relaxation, of calm, of safety, of security, etc. And when the person is so not stressed, but is connected to the safety and to the relaxation, the person is in contact with the resource, and has all the resource to overcome the problems, the obstacles, and also can have a conversation with the shame that is his part, that is an obstacle to the treatment. So this is what I told you, that when the person are in a state of calm, they can see the problems with another perspective.